Hi everyone, my name is Dr. Chisako and I am a doctor of physical therapy and I own Built Strong Pelvic Health and PT. So I wanted to talk to you a little bit today about pelvic floor physical therapy and how it works. So on the very first visit, what we go over is a lot of your history. So it can be anything from anything that's been happening previously, but also anything that's been happening for a very long time. We always want to try to get to the root cause of the problem. So the more information that you are willing to share with us, the better it would be for us to be able to truly come up with a good assessment and a good plan for your recovery. And sometimes that can be done before the session, and sometimes that can be done during the session, and whichever that you are more comfortable with, we can do. So once we get started and the history and all of the medical history is all fully done, what we do is a orthopedic component as well as an internal and an external exam with your consent. So with the orthopedic component of the assessment, what I typically look at is your posture, how you're sitting, how your hips are, how your low back is. So there's a few things that all connect with the pelvic floor, which is something that I always take a look at because everything is connected. So once we are done with all of that, then with your consent, we can do an internal and/or an external examination. Now, it might sound scary, and this is definitely something that we don't have to do the first session, and this is definitely not something that we absolutely have to do, period. It's just a much more comprehensive way of assessing. So if you are consenting to an internal examination, don't think that we are using anything like a speculum like you would at an OBGYN. It's literally just one digit, and that's all that there is. And again, if you're nervous about it, if you're unsure about it, that's totally fine. It's just doing an internal exam just gives us a better idea of everything that's what's going on. Once that is completed, then we go to typically the manual assessment and more of the manual treatment of the session. What typically I do is make sure that your hips are moving correctly, make sure that your low back with your paraspinals and your glutes are all moving the way that it needs to, because a lot of the times our muscles are really tight. With tightness, you're not able to activate a lot of your muscles. Therefore, dysfunctions happen both on the outside and on the inside. After that, we go through some exercises. So exercises plays a key role in pelvic floor PT. The amount of time that you are with me versus when you are not with me, we need to do exercises. So we're not talking about half an hour, 45 minutes worth of exercises. We're literally talking 10 to 15 minutes at a time. We fully go over everything that you need to do, and it is a personalized exercise program developed specifically for you. So a lot of pelvic floor PT is done one-on-one, and typically it's about an hour to an hour and a half session because everything is tailored to you. If it's any short, chances are we're missing a lot of things, especially from day one. So we go over the exercises. A lot of times I will give them to you afterwards via email, via Instagram, or we can even record you doing the exercises so then you have them for you to take home. After the exercises, we'll go over the plan again of all of your treatments. We'll basically go over to make sure that this is what you are looking for, make sure that you fully understand what we found, but also how to make it better. And then when we are done with all of that, we are basically done. And I typically see patients one session every 2 to 3 weeks. And I definitely follow up with you in between sessions. And that is typically how we do pelvic floor PT in a nutshell. If you have any questions, feel free to contact me. My information will be below. Thanks.